You survived your 60s. You watch what you eat. You take your medications. You do everything your doctor tells you. Your kids think they're invincible. And statistically, one of them is wrong about that. The data coming out of cardiology research right now is genuinely alarming, not for you, but for your adult children. Heart attack rates in adults over 65 have been declining for 2 decades. The medications are better, the awareness is higher, the interventions are faster. That progress is real. But in adults under 40, the numbers are moving in the opposite direction, sharply, silently, and in ways that neither they nor their doctors are catching in time. A major analysis published in the Journal of the American Heart Association tracked cardiovascular event rates across age groups from 2000 to 2023. Heart attacks in adults between 35 and 44 increased by 28% over that period. Not a small drift, not a statistical blip, a sustained, worsening trend that researchers are now calling a crisis. And the terrifying part is the mechanism, because these are not the same heart attacks you and your generation experienced. These are different. They arrive without warning. They get misread in the emergency room. And they kill people who left for work that morning looking completely healthy. I'm Dr. Anthony Miles. This channel delivers evidence-based health information designed specifically for adults over 60 and for the families watching alongside them. If someone in your life is under 40 and you care about keeping them around, this is the video you forward to them tonight. Subscribe now so you don't miss what we're covering in the coming weeks. There is a lot more on this your family needs to know. Let me give you the core answer immediately, because it's not what most people expect. The young adult heart attack crisis is not primarily about cholesterol. It is not about the dietary fat myths your children grew up with. It is being driven by four forces that are almost entirely invisible on a standard annual physical: chronic inflammation, metabolic dysfunction, undiagnosed genetic lipid disorders, and a class of cardiovascular stressors that simply did not exist 20 years ago. Your children are walking into doctors' offices, getting told their cholesterol looks fine, and leaving with a completely false sense of clearance, because the tests that would catch what is actually killing them are not being ordered. Here is what the biology actually looks like. Traditional heart attacks in older adults develop over decades. Plaque accumulates slowly in arterial walls. The buildup is gradual. Symptoms often develop before a catastrophic event: chest pressure during exertion, shortness of breath climbing stairs. There is a warning arc. Young adult heart attacks frequently work differently. Cardiologists are seeing a pattern called MINOCA, myocardial infarction, with non-obstructive coronary arteries. It means a verified heart attack with arteries that look clean on imaging. No significant blockage, which means the standard picture doctors look for is simply not there. What is happening instead is that smaller, unstable plaques are rupturing suddenly. Plaques that would never trigger concern on routine screening. Or coronary arteries are going into severe spasm. Or a condition called spontaneous coronary artery dissection, SCAD, is occurring, particularly in women under 45, who now account for a growing proportion of young adult cardiac events. A JAMA cardiology study from 2022 found that MINOCA accounted for nearly 25% of heart attacks in adults under 45. 1 in 4 young adult heart attacks happening in arteries that appear normal. If your daughter goes to an emergency room with chest pain and her imaging looks clean, she may be sent home with an anxiety diagnosis and a prescription for antacids. That has happened. It keeps happening. This is what silent looks like. Not quiet symptoms. A wrong diagnosis. Have you noticed any of these risk factors in your adult children? High-stress job, little sleep, not much exercise, or weight that has been creeping up for years? Comment below. I want to know what parents in this community are actually seeing in their kids, because the picture you're looking at day to day matters. Now let's go deeper on the 4 drivers, because if your children understand these, they have a real chance to intervene before an event. The first driver is metabolic syndrome, and it is spreading through the under 40 population at a rate that should be generating emergency public health campaigns. It is not. Metabolic syndrome is the combination of abdominal obesity, elevated fasting blood sugar, high triglycerides, low HDL cholesterol, and elevated blood pressure. You do not need all five. Three of the five qualifies. According to the National Health and Nutrition Examination Survey, nearly 35% of adults in their 30s now meet the criteria. That is 1 in 3 of your children's peers walking around with a cardiovascular risk profile that their LDL number completely fails to capture. The pancreas is struggling, the arterial walls are inflamed, the stage is set, and nobody told them because their cholesterol looked acceptable. The second driver is lipoprotein(a), written as LPA. This is a genetically determined lipid particle that drives arterial inflammation and plaque instability in a way that standard cholesterol panels cannot detect because they do not measure it. A landmark study in the New England Journal of Medicine established that elevated LPA dramatically increases heart attack risk even in people with otherwise normal lipid profiles. It is inherited. It affects roughly 20% of the population. It does not respond to diet or exercise, and the vast majority of people carrying it have never been tested. If cardiovascular disease runs anywhere in your family history, your children need an LPA test. Full stop. One blood draw. Most labs offer it. Most doctors do not order it unless pushed. The third driver is what I call the new stressors, and this category is where young adults today are genuinely in territory that has no historical comparison. Chronic psychological stress elevates cortisol, which directly promotes arterial inflammation, raises blood pressure, and triggers coagulation changes that make blood more likely to clot. But it is not just stress in the traditional sense. Vaping delivers nicotine in doses that cause sustained coronary artery spasm. Energy drinks at the volumes many young adults consume daily, 2, 3 per day, have been documented in multiple case reports and studies to trigger serious arrhythmias and cardiac events in otherwise healthy people. The International Journal of Environmental Research and Public Health published a 2023 analysis showing energy drink consumption was associated with a 4-fold increase in cardiovascular event risk in adults under 40. These are products being marketed and consumed as casually as coffee. They are not. The fourth driver is chronic sleep deprivation, and the research on this has moved from concerning to definitive. Adults consistently sleeping under 6 hours per night show measurably higher rates of arterial calcification, inflammatory marker elevation, and impaired endothelial function. The lining of blood vessels literally loses its ability to dilate properly. A Harvard Medical School study tracked cardiovascular outcomes against sleep duration and found that sleeping under 6 hours was associated with a 48% increased risk of cardiovascular events. Your children staying up until 2 a.m. scrolling, then getting up for a 7 a.m. commute, are not just tired, they are doing compounding cardiovascular damage every single night. Here is what stopped me when I went through the full research picture. The combined effect of these 4 factors in a 35-year-old is not additive. It is multiplicative. Each driver amplifies the others. Metabolic dysfunction worsens inflammatory response to stress. Sleep deprivation worsens metabolic dysfunction. Elevated LPA combined with vascular inflammation becomes acutely dangerous in ways that neither factor produces alone. This is why a 38-year-old with no chest pain history, no known family history, and a normal annual physical can be dead within 72 hours of their last doctor's visit. Let me tell you about someone who almost was. Daniel was 36, healthy by every conventional measure his primary care doctor was using. Normal cholesterol, normal blood pressure in the office, non-smoker. He came in because his father, one of my patients, had insisted he get a full cardiovascular workup after watching a video much like this one. What we found was a metabolic syndrome picture just below the diagnostic threshold, meaning he had 2 of the 5 markers rather than 3, so technically he didn't qualify. His CRP was elevated. His LPA was in the top quartile. He consumed 2 energy drinks daily and averaged 5 hours of sleep. His coronary calcium score, a CT scan that detects early arterial calcification, showed calcification that placed him in the risk category of someone 20 years older. None of that appeared on his annual blood work. All of it was addressable. We caught it because his father pushed. 3 years later, Daniel runs 4 days a week, sleeps 8 hours, and his inflammatory markers are normalized. He has 2 young daughters. That is what early detection actually looks like, and it starts with a parent who knows what to ask. Here is exactly what you need to tell your adult children to do. Ask their doctor for a complete cardiovascular risk panel, not a standard lipid panel. Specifically, an LPA level, a high-sensitivity CRP, a fasting insulin level, and a hemoglobin A1C. These 4 tests collectively reveal what a cholesterol panel completely misses. At most labs, the out-of-pocket cost for all 4 is under $100. This is not exotic medicine. This is the baseline picture a modern cardiologist uses. If any risk factors are identified, particularly elevated LPA or metabolic syndrome markers, request a coronary artery calcium score. This is a low-radiation CT scan that takes less than 10 minutes and gives a direct measurement of arterial disease progression. A score of 0 in someone under 45 is genuinely reassuring. A non-zero score in that age group demands immediate, aggressive lifestyle intervention. Tell them to stop all energy drinks immediately, not reduce, stop. The cardiovascular risk-to-benefit calculation on those products for adults with any underlying risk factors is not defensible. Sleep is non-negotiable. 7 to 9 hours, consistent schedule. This is not a wellness preference. This is cardiovascular medicine. The data on sleep deprivation and arterial damage is now as clear as the data on smoking. Stress management with a measurable physiological target. The goal is not to feel calmer. The goal is to keep resting heart rate variability in a healthy range, a metric that can now be tracked with common wearables, and to keep CRP below 1 milligram per liter. Give them something to measure. Vague advice to relax does not change behavior. A number does. If LPA is elevated, discuss with a cardiologist whether niacin therapy, PCSK9 inhibitors, or the emerging RNA-targeted therapies now in late-stage trials are appropriate. This is an area moving fast, and your child's cardiologist should be aware of the current pipeline. The bottom line on this is hard and simple. Your generation is finally benefiting from decades of cardiovascular medicine catching up to the risks you faced. Your children are running toward risks that medicine has not caught up to yet. The tests exist, the interventions work, but they have to be sought. They will not be handed to a healthy-looking 37-year-old at a routine physical. You can change that. Tonight, at dinner, send this video, or make the call and tell them what you learned. That conversation may be the most important health conversation your family has this year. Comment one of these right now. Comment sharing this if you are sending it to someone in your family today. Comment the age of your adult child if you are genuinely worried. I want to see what ages parents in this community are most concerned about. Or comment, had no idea, if something in this video genuinely surprised you. Your responses shape what we cover next. If this channel is giving you real, actionable information and not just content that sounds good but changes nothing, subscribe and stay with us. Next week, we are covering the single most underdiagnosed condition in adults over 60 that is directly increasing your family's genetic cardiovascular risk without anyone realizing the connection exists. I'm Dr. Anthony Miles. Your family's health is the only reason this channel exists.